Turning back to the health care debate, House Majority Leader Steny Hoyer saying today that the health care bill momentum is, quote, growing. But with concerns about the use of deem, which is a procedural type of situation, and pass, another part of that, and the latest Congressional Budget Office score, is that momentum for or against the bill? Joining me now from Capitol Hill, Republican Representative Don Manzullo of Illinois. Welcome, Representative. Thanks for joining us.
Good to be with you.
Have you seen any of this? It's on the website now. Have you looked through it at all?
I'm just having my staff download it, but I understand that instead of there just being one page, that they've decided to put 4 pages on 2 sides to diminish the actual size of the bill. Okay. At least that's a rumor that we've heard.
Okay, so they're saving paper.
At it yet.
All right, that's good. Let's not be wasteful in Washington. I'm happy about that. Some of the points, and we can at least put some of these up on the screen, things that appear to have changed. They've lowered some of the penalties for both individuals and businesses who didn't get coverage, trying to encourage people to get coverage. Another couple of things, taxing the so-called expensive Cadillac plans, that won't happen until 2018. Looking at any of these changes, does anything convince you at all, Representative, to get closer to maybe voting for this thing?
Liz, absolutely not. I mean, they're going to take the Cadillac plan and say, oh, by the way, we're going to tax you, but that'll be several years from now. To use that as an inducement so that somewhere down the line you can lower the price on it. Liz, what bothers me, my wife had cancer 4 years ago, and she has a titanium brace in her back. She had the utilization of some great radiology machines, the best machines in the world. People in America don't realize that those machines are taxed. There's a 2.5% excise tax on medical equipment. And the whole purpose of this bill is supposed to bring down the cost of health care. How can you do that when you're taxing these life-saving devices? It doesn't make sense.
Well, I know the Democrats, and I've spoken to some of them about this, they would argue that that's the way that you're going to eventually get all these people covered, is making it a little bit painful for the higher income earners and then putting fees on some of the medical products makers. Understandably, the products makers absolutely despise that. But let me bring it around to this, Representative. Talking about people who would be unhappy with this. Look, pre-existing diseases, those people can no longer be dropped because of this bill. Cadillac health plans will eventually be taxed, but deeper down the line. Huge rate increases that we've seen recently on behalf of insurers, those would be crimped. People who are covered by employers would still get to keep that insurance. So that whole group won't be complaining.
Well,
who will?
Well, just a second. But buried in the bill is the authority of the federal government to determine insurance rates. And granted, you know, some of these companies have had very large rate increases, and we think that's wrong. But there are other ways that we can solve these problems, and you can do it incrementally. For example, if you had taken 10 or 15 small bills, and the first one would be to increase community health centers, passed unanimously. Second one would be to have association health plans in order for small groups of people and individuals to join together in massive purchasing pools. Now, that's how you get your savings, and that's how you bring down the cost. And in that bargaining power, that's how you can do away with the pre-existing illnesses. But there's nothing free in life. And if you sit there and try to accommodate everybody and to try and insure everybody, ultimately that's going to raise the cost of health and accident insurance. In fact, CBO, it depends on which study you look at, says eventually it's going to raise the cost of health and accident insurance.
Are you going to be working all weekend to read this thing, Representative? I mean, it's really looks like it's coming down to the wire. Do you think they'll get enough votes to pass this?
Well, they won't bring it to the floor unless they get enough votes. I guess my question is, are they going to tax the medical device that is used to repair the broken and twisted arms as a result of trying to get people to vote for this bill?
Okay, I'm glad you have some humor about this. I know it's hard during this time when there are such fundamental differences, but Representative, thank you for coming on to state your case. Anytime.
We'll talk to you later. Thank you.
Representative Donald Manzullo of Illinois, our appreciation to him.